All right. Thank you very much for having me and for allowing me to participate from afar in San Francisco. I'm at the San Francisco Foundation right now. I'm Sarah Treuhaft. I am a managing director at PolicyLink. PolicyLink is a national research and action institute, and our mission is advancing racial and economic equity. Our tagline is lifting up what works. We try to find what is working in low-income communities, communities of color, and spread that through policy change. And my role is overseeing our economic opportunity portfolio, and I lead our research partnership with the USC Program for Environmental and Regional Equity. Their acronym is PEER, and we produce the National Equity Atlas, which Brian mentioned. Thank you. And so what I was going to do today is share a little bit about our work through the National Equity Atlas Partnership, which is really about supporting communities with data on equity to drive broad equity agendas, including health equity, but beyond that as well. And then share how we think about operationalizing health equity and a few recommendations for you all. I reviewed your materials. I'm a bit jealous of your task. I feel like it is enormous and challenging and very, very important. And so we'll share a few recommendations with you. And this is an introduction to our work. I mentioned what PolicyLink does. We were founded in 1999. The National Equity Atlas is a product of our partnership with USC, and it is a comprehensive data resource to track, measure, and make the case for inclusive growth. And it draws upon many of the databases that Brian was referencing, and it includes data for the U.S. as a whole, all 50 states, the 150 largest metropolitan regions in the United States, and the 100 largest cities in the United States. So our task and my orientation to thinking about data and equity is really oriented to getting down to the community level and disaggregating by race, ethnicity, gender, nativity, and income as much as possible. So a little bit about that work. We formed a partnership with PEER at USC in 2010, really recognizing that PolicyLink as a think and do tank that was working to affect policy change to increase racial and economic equity. We relied upon data to drive our work, but we lacked the data capacity that we really needed to advance the work and to work in partnership with local communities across the country. And so we formed a long-term organizational partnership with PEER, which is a research institute headed by Dr. Manuel Pastor, who has done some incredible research on environmental justice and equity, inclusive growth, oftentimes in partnership with Dr. Chris Benner. And we formed this partnership that is providing data to communities. So we say that our three goals are first democratizing equity data and making it broadly available. Back in 2010, at that point, it was very, very common to not see any disaggregation of data by race. Now it is much more common, and so we've seen a lot of improvement in the field, but still the data that we provide through the National Equity Atlas, which is really our portal for democratizing data, is oftentimes still hard to find in a useful form. So that's one of our key goals, is democratizing the data. The second goal is producing valuable research and analysis that helps to make the case for equity, to spread the message of equity and why it matters to all communities in a positive way. As Brian was saying, we actually believe that equity is the superior growth model and benefits all communities, and highlighting solutions. So research is another piece of our work, and then informing community action. We work in partnership with local communities at the regional city level, usually, sometimes the state level, to support their work and to conduct holistic analyses of equity in their communities. And a few ways in which the National Equity Atlas is unique, or maybe it is that by combining all of these elements, it makes it unique, because there are many other wonderful tools out there that Brian mentioned, such as the County Health Rankings and Roadmaps and the Health Equity tool Brian just shared with you. We see our role as helping to provide a narrative and a messaging framework around how and why equity matters, especially as our country is undergoing tremendous demographic shifts. We believe that inequity and inequality both threaten our economic prosperity, and that by increasing equity, increasing opportunity, we create better communities and a better nation for everyone. So that narrative undergirds the Equity Atlas. We provide disaggregated local data, and I'll share more with you about our disaggregation. You'll see some examples of that. We share some unique indicators and analyses. For example, we have an indicator that looks at the potential gains to gross domestic product, to GDP, or the total economic activity in a place if there were not racial gaps in income. So that's one example of a unique indicator, a sort of somewhat less unique but rare indicator that we include in the National Equity Atlas. I included in the background materials is working poverty. So what share of people are working full-time but still live below the poverty level or below 2 times the poverty level. Our atlas is undergirded by a framework that we developed in partnership with communities through our creation of equity profiles and in dozens of regions across the country. So we used this framework, developed a framework for thinking about equity in terms of participating in the economy, contributing to the readiness of the workforce, and being connected to the region's or community's assets and resources. And that is the framework that we use for looking at equity. The 5th piece is around data for policy change, that we provide data, but also provide strategies and responses. So you're looking at indicators of equity, and we provide strategies and policies that are some evidence-based, some based on promising practices that communities can implement to see some change on those indicators. And the last part is really about trying to be user-friendly and approachable and democratizing the data, making it accessible and available to all. And to create our framework that I said, we have a community-tested framework that undergirds our equity profiles. We had to come up with a definition of equity for our profiles. And the policy link definition of equity is that equity is just and fair inclusion into a society in which all can participate, prosper, and reach their full potential. And when we started creating these equity profiles and going down to the community level, we created a variation on that definition to define what an equitable region looks like. And that's what you see here, that regions are equitable when all residents, regardless of race, ethnicity, nativity, gender, neighborhood of residence, are fully able to participate in the region's economic vitality, contribute to the region's readiness for the future, and connect to the region's assets and resources. And what do we want to see when we're looking at equity metrics? We want to see improvements across all groups, but we want to see a faster rate of improvement for groups that are marginalized, excluded, or vulnerable, right? And so oftentimes when we're looking at indicators of rate, that's what we want to see is over time. We want to see everybody improving in terms of the types of aspirational indicators Brian was talking about, but we want to see more improvement for those who are being left behind. And so that's how we want to see reduced disparities. We don't want to see people's health getting worse or people's outcomes getting worse on these indicators. even if they already have more to begin with in general. So that's our perspective on the equity metrics. And our work at the community level, this is a picture of the profile where we've created equity profiles in partnership with communities. It's actually missing a couple recent ones, but we've produced these equity profiles in more than 24 places. I think it's about 30 at this point. And from that process of looking holistically at the state of equity in a community, it has allowed communities to oftentimes come together around a share and create a shared understanding of what is happening in their community, what is the state of equity now, and how do they want to see realize a more equitable future. And so we have dozens of equity indicators that we look at in each place, but then we also create a set of recommendations in partnership with these local communities to move them forward. Oftentimes people are interested in creating these profiles or working with us on these profiles at the beginning of processes, but they oftentimes spark both a shared understanding, a more holistic understanding of the state of equity and where these collaboratives or communities want to go, but also policy changes. So for example, in Fairfax County, Virginia, the equity profile led to their development of a holistic One Fairfax equity policy, which is now undergirding all of their policies in the city. They always analyze their policies using an equity lens, and that includes their investments in development projects such as the redevelopment of a Mount Vernon historic school. Another example in Rhode Island, the state of Rhode Island, we produced an equity profile in partnership with them, and then the governor announced an equity and inclusion policy, and an office was created at the state level to inform equity policies, really having to do with the state's workforce and procurement policies, and that is ongoing. And another last example I'll share is in the Bay Area. The San Francisco Foundation was our partner in creating an equity profile here, and they used the profile to launch their equity framework. And now we are, a few years later, creating a Bay Area Equity Atlas tool with them to democratize that data, to add in unique indicators. And that tool is about to launch on June 5th. And the data has really undergirded their entire investment portfolio. All right, so shifting, that's a bit about our work. I'm going to shift into how we think about health equity, and then some examples of our more recent work that are sharing some indicators and data with you, getting into my recommendations. So health equity, I'm going to go quickly through these because I'm fairly certain that you all are familiar from your materials, that you're familiar with these frameworks. So we worked with Paula Braveman in creating the definition of health equity, which you see here. And so it's not completely our creation, but we worked with her on it, and this is the definition that we use. I think that it's very important to acknowledge the barriers and obstacles, including poverty, discrimination, and power. And so we really liked those elements of this definition and think that this is a good one to use. We also are very much of the opinion that the social determinants are incredibly important to focus on to achieve health equity. And we very much, I think Marjorie probably shared this with you, and you probably know it, the framework that's used to undergird the county health rankings and roadmaps that shows how much social and economic factors and social determinants contribute to population level health. And the link between social determinants and health inequities, I think, is also well established in the field. And this is a quote from the World Health Organization that's really talking about how the social determinants of health are mostly responsible for health inequities. And that's what we see and why we think it's very important to focus on those elements. in our own work, in our health equity work, we put out a framework in a report called Why Race and Place Matter. And this flower illustrates how we think about it in terms of, and I think that there are many different valuable frameworks, but we think about it in terms of place and race being at the root of our analysis of health equity and inequities, and need to be considered throughout. And we need to look at the economic, physical, social, and service environments to capture the social determinants. And so I think that this overlaps completely with the types of social determinants that you're looking at in terms of access to care, the physical environment in terms of toxics, access to transportation, et cetera, the social determinants in terms of political participation and economic. So this is a framework that we've put out and have used this for many years. And the next section, I wanted to share with you our approach to looking at economic insecurity and race. We recently put out a report, 100 million and counting, and this was shared with you, I know. And this is how we've been starting to think about race and the economy and economic opportunity, is that we cannot continue to look only at the poverty level, that we need to look more broadly at economic insecurity. That the poverty line is an important threshold and it is important to consider, but it is too low. It does not capture what people need to live well. And so what we've been looking at is 200% of the poverty line. If the poverty line is about 12,000 for a family of one, about 25,000 for a family of four, so double that, being a more useful way of looking at who is excluded economically. And we looked at what it looks like nationally, and there are 100 million, more precisely 106 million people in the United States, and this includes adults as well as children, living at the 200% of the federal poverty line or below, and that is increasing over time. So I'm going to share with you some of our analysis looking specifically at that population, which we've really carved out as the population we are trying to support and increase economic security and the ability to live in healthy communities of opportunity for this population. So what you're looking at here is a disaggregation of the population by race. And so what we see is that the white population is, of course, larger. 62% of the total population is white, but only 48% of the economically insecure population. And so we see that the economically insecure population is still a large number of white people are economically insecure, but more people of color. People of color are overrepresented in the economically insecure population. We also see that the economically insecure population is increasing. So economic insecurity has been increasing tremendously over time. And so this slide shows you the growth in the economically insecure population. So it's grown 6 times as fast as the economically secure population. The yellow is the economically insecure population. And so it's grown tremendously since the turn of the century. Some characteristics of the economically insecure population that I think are really important for you to consider when you're thinking about your leading health indicators. So this is showing you the breakdown of homeownership within the economically insecure population by race. And so what we see here is that 41% of the total economically insecure population are homeowners, and you can see that variation, the dark yellow, you can see the variation by race here, where it's 50% of the white population that's economically insecure, but only 27% of the Black population, and a higher share of the Native American population, for example. So this is
Sarah?
one important thing
Sarah,
to consider when you, yes?
We're a little short on time, so if you could
Yes.
make some additional comments to come to the end of the presentation, we'd appreciate it. And we'll
Yes,
share
thank
the
you for letting-
slides, is that right? Sorry. We will
Pardon
have
me?
the slides available.
Yes.
Yeah, we have the slides, and this is really important, but we want to make sure we have adequate time for the conversation and the questions, which have been also very important to our conversation before we adjourn in a few minutes. So,
No problem. Let me just click through to my recommendations, and I'll end there, and you can have the slides with the data after and look at them after. I'm just going to go through to this slide. There we go, this one. So my recommendations here, one is to use a holistic framework, looking at the social determinants of health. So more than one, I think, is very important. Two is disaggregating both by race and income, which I was sharing with you from our report, but also by race and gender, because you see large variations there. And by ancestry, as Brian was mentioning, we have disaggregated by ancestry, and you see a lot of differences with, for example, the Asian and Pacific Islander population. Choosing metrics that increase data availability is very important. I think that a key equity metric really is looking at the racial wealth gap. That is really where you see the most differences by race. So that would be a recommendation there. Looking at reducing poverty, but both economic insecurity, which ties into our research around the economically insecure population. Housing burden, I know, is recommended, and I strongly check that one. I think that housing burden is a very critical indicator, but you do need to disaggregate by tenure because of the difference in homeownership. And I thought that the recommendations around children with incarcerated parents, transportation access, and not just access to jobs or employment, but access to quality jobs, I would recommend. And I will stop there and leave you with my data slides for further analysis.
terrific.